Hi, this is Dr. John Paul Gallardo. Today's case seemed like it was going to be pretty straightforward. We're replacing two first molars with dental implants. The removals had been done by a previous dentist, and then the patient came to our office with these teeth already missing. So we took a CT scan and everything seemed to be okay. And then when we opened the area surgically, we found some retained root tips that kind of looked like they could be bone, but when we saw them live and in surgery, apparently the dentist that did the removals left some fragments of the tooth behind. So we just took those out, no big deal. Now, one of the things about this case that I wanted to really show was the depth, or how deep we actually place the implants. Because the most common mistake that I see when I see other implants being placed in other offices is that they don't go deep enough. And if you don't go deep enough, then you're not going to have enough room for the crown to kind of come up and have a natural shape and a natural, what we call an emergence profile. Another very common mistake that I see is when implants are placed in between other implants. In other words, implants that have already previously been placed and crowns have already been made and stuff like that. So if we're placing an implant either next to another implant or in between two implants, we want to make sure that we're placing the implants at the same level as the adjacent implants. Because what happens is bone will actually start to kind of resorb away and come close to the point where that implant starts, where the connection starts. So if that happens in between two other implants, and all of a sudden the bone is being pulled away from the adjacent implants. So the little details, and one of them being how deep the implant is placed, is critical in terms of function, in terms of cleansability, in terms of cosmetic or appearance, and most importantly in terms of health, making sure that we maintain stable bone levels. Okay?